Good morning, good afternoon, everyone. So used to seeing everyone in the morning. Good afternoon and welcome to the joint committee meeting with Education and Culture and Health and Human Services. I am Councilmember Lori Ann Sales and joined by my colleague, Chair Jawando of the E&C Committee. We also have Council Member Shebra Evans. Councilmember Kristen Mink will be joining us in a bit. She is doing double duty in our T&E meeting. I'm joined by my committee members, Council Members Lutke and Councilmember Friedson. Thank you. And today we will be discussing two significant items for today's work session. Today's work session will focus on two major components of HHS's FY27 operating budget that we will be discussing together, both of which directly shape the well-being and long-term outcomes of children and families in Montgomery County. So item one is our Children, Youth, and Family Services. We'll be discussing HHS's substantial internal reorganization, how programs, staff, and resources have been realigned to better meet the needs of our young people and their families. We'll hear updates on this restructuring, programmatic shifts underway, and the major budget changes affecting some of our most essential supports, including the Lighthouse Initiative. We will also talk about item two, which is school-based services and partnerships. This will encompass school health services and the newly created school-based mental health and related services program area. We will also look at the implications of consolidating programs like linkages to learning, high school wellness centers, and therapeutic mentoring in this reorganized structure. The two items together reflect the county's commitment to building a coordinated, equitable system of care. I want to thank Ms. Nicole Rodriguez Hernandez and Tara Clemens Johnson for preparing today's packet and grounding our discussion in data, service impacts, and the realities facing our providers and partners. And before we begin, I would just like to invite Chair Jawando to provide any remarks before we get started.
Just will say thank you for teeing that up and looking forward to the conversation. Some of the most important services for our young people in the county, both in and out of school. So look forward to the conversation and decision points. Thank you.
Thank you, Mr. Chair. All right. Thank you, Ms. Nicole Rodriguez Hernandez.
All right. Good afternoon, everyone. Thank you. All right. I want to start off by thanking our partners at the Department of Health and Human Services and MCPS and Office of Management and Budget for their time for today's committee work session. I will try to maintain a very clear discussion as we move through the packet for today, as we are combining some items from different areas within HHS. So as the chair noted, today we will be reviewing three areas. The first is the Department of Health and Human Services Children, Youth, and Family Services service area. In years past, we have divided the review of this service area based on its relation with MCPS and other areas, but due to the reorganization, we are reviewing all of the Children, Youth, and Family Services area today, except for early care and education, that early childhood services that we reviewed last week on April 21st. We will also be reviewing the school health services program area that resides under public health services as well. And because of the reorganization, we will be reviewing the school-based mental health and related services program area, which is a new program area that we discussed originally as it is now under the Behavioral Health and Crisis Services service area. So just to start off with that overview. As the packet shows at the table of the bottom of page 2, we show the FY26 approved as realigned compared to the FY27 CE recommended. So we can see about a $10 million increase or 21.2% increase with a slight reduction in FTEs due to the realignments. The executive's recommendation includes 16 items for the council's review. However, $1.6 million worth of those items, or 5 items, are specifically would be added to the reconciliation list per the council president's budget approach. We also have a point here that the recommendation includes $7.2 million increase in the Children, Youth, and Family Services service area related to the Lighthouse Initiative. To provide just an overview, on page 3, we have the department background where we've provided the mission statement of the service area of children, youth, and families, as well as the program area of school health services. I would just like to note again for housekeeping due to the reorganization and as we move into council's final budget approval and the council version of the approved budget book, just noting to eliminate the Office of Community Affairs from the school health services program area as that office no longer exists in DHHS's reorganization, and then same for the school-based mental health and related services program and area under the behavioral health and crisis services to amend the text to reflect the new program title and all of the services they provide. I'd like to note again that the HHS committee reviewed the department's operating budget equity tool analysis on April 16th, and that information is provided for you on page 4. We do have presentations from our chiefs of children, youth, and family and behavioral health and crisis services to discuss their service areas, their programs, and the realignment. But did just want to note the table on page 5 provides additional details where you can compare the fiscal year 26 children, youth, and family program areas to the impact on fiscal year 27 and beyond. So for example, the existing administration children, youth, and families program area, social services functions used to be in that program area and now has shifted to their own separate social services service area. The child and adolescent school and community-based services program area from fiscal year 26 has now realigned to the behavioral health and crisis services service area under that school-based mental health and related services program area. Child care subsidies has been realigned to just be absorbed by the early childhood services in the Children, Youth, and Family Service area. The Positive Youth Development Program area has been renamed to the Community and Youth Violence Prevention and Intervention Program, and high school wellness centers were shifted from that program area to the new Behavioral Health and Crisis Services School-Based Mental Health and Related Services Program area. The Early Childhood Services Program area now has absorbed child care subsidies and the Head Start program area from within DHHS, and the Linkages to Learning program area has been absorbed by the Behavioral Health School-Based Mental Health and Related Services program area. Children, Youth, and Families now has the Lighthouse program area that used to be one-time funding, and my colleague, Ms. Clemens Johnson, will discuss that later on in the review. And they also have the Community Action program area that's composed of the Community Action Agency, Test Center, clusters, East County Coordination, Navigations, and Service Consolidation Hubs. And then the final new program area for children, youth, and families is the special projects and initiatives that includes things like the Youth Resilience Initiative that the Council discussed on April 21st, out of school time, family resource capabilities, and coordination with the Commission on Children and Youth. When we look at the vacancies, Children, Youth, and Families currently reports 10 position vacancies. 8 are funded through the general fund and 2 are funded through the grant fund. And I did also include the school health services vacancies has 15 reported vacancies. All are funded by the general fund, with most of them being either in the recruitment through candidate selection stage. And the tables and description of that can be found on page 6. The multi-program adjustments for children, youth, and family are all related to the reorganization and what I just went through and the discussion of how things were realigned. So you can see the details of that on page 7. Council staff did request and the department did provide a lot of service impact data on key programs that the Joint Committee has previously been very interested in. We've provided detailed information as they relate to the budget changes, but we also provided the supplementary information for you on circle pages 12 to 29, and the department will also speak to that in their presentation as well. So that is it for our brief overview of the packet before moving into the budget discussion items, and with the chair's permission, we can turn it to the departments for the presentation or for questions.
Yes, please.
Thank you. So sorry. Also wanted to mention that Councilmember Katz has transmitted a memo to his colleagues on the EC and HHS committee relating to additional funding for a Linkages to Learning program at Twin Brook Elementary School. This would be related to the services that HHS funds and provides, and not for the CIP portion where there would be a complete renovation of the space or a new facility. So we can also discuss that at the end of the budget discussion items as the chair wishes. Okay, thank you.
Yes, thank you. All right, Ms. Aquino.
Good afternoon. Lori Garibay-Aquino, Chief of Children, Youth, and Family Services. This afternoon, I'll just be going over a quick overview of CYF. I know we've had a chance to discuss a lot of our programs so far last week in multiple sessions. So we can go to the next slide. So within Children, Youth, and Families, basically our mission, as indicated here, is to provide integrated evidence-based programs that promote the health and safety of youth while helping families achieve economic stability and overall well-being. As mentioned earlier, within CYF, we have evolved a bit as part of our recent departmental realignment. We have 5 program areas, which you'll see listed here. We have early childhood services, again, which we reviewed earlier last week. A new program area to CYF is our Community Action Agency, and they are our locally legislated anti-poverty agency, advancing social and economic mobility among our communities in the county. We have our Community and Youth Violence Prevention and Intervention Program, formerly known as PYD, which we also covered pretty extensively last week as well. Also new to CYF is our Lighthouse program, and this is really our county-led initiative designed to support individuals and families who are facing challenges related to their immigration status. And then finally, we have our Special Projects and Initiatives, which is another new program area to CYF. And this team really works as our centralized hub to manage strategic and cross-cutting tasks and programs across the county and across the agency. So we have our Youth Resilience Initiative housed within this program area as well. And here you'll have our FY27 recommended budget and our total current FTEs within CYF. So we'll just go a little into more detail on CAA, specifically covering those programs that are new to that program area. So here's just a quick overview of the programs in CAA, many of which I'm sure you're familiar with already. New to that program area, I just want to highlight is our Clusters Project, our East County Coordination Project, and our Service Consolidation Hubs. So we'll go into more detail on those new programs in a bit. So starting with our Clusters Project, because this is kind of a school-based, school-focused session, I did want to highlight those programs in CYF that we haven't had a chance to go over so far. So the goal of Clusters is really to improve family stability for students for whose families are in need or in crisis and in need of multiple supports outside of the school system. So that the students can stay fully engaged in school. And it's important to note that the Clusters Projects only serves families of students who are enrolled in one of these 3 clusters that are listed here, which are Kennedy, Paint Branch, Springbrook, and Watkins Mill. The program has been in existence since 2009 and really offers core care coordination services and referrals to needed benefits and services for families. Historically, we provided behavioral health navigation through clusters, and now part of our realignment, we work very closely with our BHCS colleagues to continue offering those services in clusters. It's also important to note that this is really a multi-agency model. So our team works closely with MCPS, of course, our other programs in HHS, Recreation, and a host of other community-based providers. In terms of impact in FY25, the project served just under 300 unique families, consisting of about 1,100 individual household members. The project provided just over 1,400 referrals, and in terms of evaluating outcomes, we found that 90% of our clients reported improved family stability after receiving services from clusters. So another new program within CAA, not new overall, is our East County Coordination Program. Our ECC is based in our East County Regional Services Center, which there's a very blurry picture of here. But the program offers navigation and coordination services similar to our Clusters program. However, there's no requirement for clients to have students who attend one of those 3 clusters. So really any individual living in East County can go into the Regional Services Center and receive services from our East County Coordination Team. In FY25, the program served 108 total unique clients and provided 291 referrals for benefits and services. This next slide is just a quick overview of the schools served by the Clusters Project. So far in FY26, I forgot to mention this, the team has noticed an increase in services in clients being seen by clusters, and that's mostly due to the fact that the team was able to increase the number of schools served this past fiscal year within clusters. So last year we served about half of this number of schools. So I think it really speaks to a testament of the work that we're doing with MCPS, the dedication of that team as well to get as many services as possible to our community. In terms of looking ahead and goals that we have with the CAA team, now that we have mostly all of our navigation and kind of care coordination services centralized under one team in CAA, we are really looking to go into a little bit more detail and really improve the level of services that we provide. So we're looking at a direct family services tiered model to provide broader services and also further kind of be able to measure the community impact that all of these programs are having. We hope to continue with building our community engagement and working with our local, state, and national partners to support the work that we're doing here in the county as well. So next I'll just go briefly into our community and youth violence prevention and intervention programs. The next slide is just a quick overview of all of the programs that we have within this team. I know we talked a lot about our Sun and Safe Space program last week, and those are really great programs that our internal teams are leading and doing the work directly in the community, but we also have a host of other contracts with community-based providers, which you'll see here with the asterisk as well. So this chart is just a quick breakdown of the number of youth served across all of the programs we have within this program area from FY25 and where we are through February 2026. I do just want to note that we do anticipate these programs meeting a similar number of clients served as they did last fiscal year, especially as we start to approach the early summer and spring months. Focusing more so on our high school wellness centers, which of course are working directly in our schools. So there are 6 wellness centers located in MCPS high schools, and the aspect of the wellness center work that's focused in CYF is really those non-somatic health pieces specific to behavioral and mental health. As stated earlier, this work will transition over to BHCS at the start of FY27, but now we're working very closely with our 2 teams to ensure an efficient transition. So the 6 schools are listed here, and you'll see a breakdown of the number of youth served in FY26. So, and in FY25. So in FY25, we had a little over 3,000 unduplicated students served. And you'll see in FY26, we are on track to meet those numbers as well. In addition to the number of youth served, we also do an intense evaluation of the services we provide. We found that 70% of youth and families served report satisfaction with our services. More than 50% of the youth served report improved relationships with their parents, and we've seen an overall decrease in violent behavior, disciplinary actions, and other delinquent behaviors such as drug, alcohol, domestic violence as well. Next slide. All right, so we'll go into a little bit more detail of our Lighthouse program. So Lighthouse has a long history. I will say in FY26, we transitioned from a contract model to a grant-based program within our Office of Grants Management. And again, the goal of Lighthouse really at its core is to move individuals and families from crisis or instability toward long-term stability and integration and self-sufficiency. So we work very closely with our grantee to provide these core services, navigation, to help kind of mitigate the challenges that families and individuals face when they're seeking services. We provide emergency stabilization, which could look like one-time or short-term financial assistance, basically really quick help for individuals to meet their basic needs. We offer intensive case management, and that is really our high frequency targeted support for individuals and families who need that level of care, and of course legal clinics which offer consultation only services. So just some quick highlights of our Lighthouse grant program to date. So we've developed and implemented a new data reporting framework to refine and strengthen our approach to data collection with our grantee and our program. In the first 4 months of the grant period, we've had just a little over 1,400 unique families served through Lighthouse, with our top 5 client needs being listed here: healthcare access, legal services, workforce development, food assistance, and housing. We've also had a little under 1,800 outgoing referrals completed since October 2025. And of all the individuals that we've served, we've successfully closed 236 cases, with 94% of our families achieving stabilization and 59% of those closed cases reaching self-sufficiency. I would say, in addition to the quantitative data that we also have very rich qualitative data, which speaks more to the stories of the individuals that we're seeing and the families that we're seeing. I won't share them now, just in the interest of time, but I do welcome being able to share those with you at a later date as well. I think they really speak to the work that the program's doing. In terms of looking ahead with Lighthouse, we're continuing to strengthen our supports to families, really working across agencies and deeper with our community-based organizations. We're continuing our data improvement efforts. I do want to note that the notice for funding opportunity is live and available, with the applications closing in a few weeks. This time, this will be a multi-year project period, which is a great improvement for us. It really allows our team to develop stronger program development. Of course, it'll be less administrative burden for the grantee, but it'll also allow us to examine and evaluate the long-term impacts the program is having on the community. Next slide. And then finally, the last new project area within CYF is our special projects and initiatives. Within this team, as stated earlier, we do really work on those cross-cutting kind of new initiatives that come up across the department and across the county. Our Youth Resilience Initiative is housed here. We also have over 20 contracts and grants with community providers to provide out-of-school time services. We have our family reunification capabilities, and also our Commission on Children and Health as well. And then finally, this last slide just provides a quick overview of kind of the areas where those 20 plus contracts and grants work towards. And that is it for me. Thank you.
All right, so for the record, Monica Martin, Chief of Behavioral Health and Crisis Services. And I gotta say, this is a little bit of a full circle moment for me, because I'm going to be talking to you about the school-based mental health and related services that I used to oversee in my former position that are now in the service area that I became the chief of. But before even going into it, I just want to say that already with this realignment, the synergy and opportunities for just much closer coordination and integration across CYF and BHCS have been very exciting to be a part of, and that it's just an honor and a pleasure to partner with Chief Gary Aquino in doing that work. But the slides are up. They are up. So I'm going to focus on, of course, those services that are funded through our general fund, and those are operated through our Child and Adolescent School and Community-Based Services Program area, which helps children, youth, and families thrive by coordinating school-based initiatives that strengthen family stability and promote mental wellness, of course. So obviously, the overall mission here is to serve as a trusted bridge between families and very complex systems of care, trying to distill those systems and make them accessible to families and students through the schoolhouse. And so it includes mentoring and youth development opportunities. All of these initiatives are operated in partnership with community-based vendors that are key partners and have been for many years in these initiatives. And the impact and combined of all of these initiatives is that over 2,400 clients are served on any given day across more than 52 MCPS schools. Next slide. So those initiatives, as council staff already reviewed, are linkages to learning, bridge to wellness, school and community youth services, and therapeutic mentoring. And I'll go into those a little bit more. So next slide. First, want to just share a map of the school service locations and span for these different initiatives. You have different kinds of legend codes there for not just the elementary and secondary schools, but also where Bridge to Wellness lives, where Linkages Learning exists. Where Linkages Learning exists is part of a school-based health center at the elementary level, bless you, and then what clusters, which are most of them across the county, we have therapeutic mentoring now available for. Next slide. So with Linkages Learning, we are now at 33 schools. That's 25 elementary schools and 8 middle schools. They are listed here for your review. Those that have an asterisk next to them are the ones that are co-located and integrated as part of a school-based health center. And that's 10, again, of the total 33. And we are at schools that have an average 73% FARMS rate versus the 46% MCPS average. And that's what we target, our communities that are affected by higher rates of indicators of poverty. Also, the mobility rate on average for Linkages to Learning schools is about almost 26% as opposed to the MCPS average of about 17%. In terms of services provided, many of you are very well aware of these. There's child and family therapy, there's family care management. The community school coordination piece of the Linkages to Learning contracts and scope is the piece that has been decreasing over the last several years as MCPS has picked up that work through the addition of community school liaisons as part of the Kerwin funding that they receive directly as a local educational agency. But we do still provide it in any school where a community school liaison does not exist. That MCPS position does not exist. Here you've got our numbers served, and you see that there's an upward trend between FY24 and FY25 overall. The only place that you see a downward trend is in the community sessions. And again, that's because that's the work that's conducted through the Linkages community school coordinators, of which there were fewer in FY25 than 24 because of those additions that MCPS was able to purpose at some of those schools. But one of the great outcomes here in terms of the care management work is that 81% of our families served show demonstrated increased self-sufficiency. And we're going to talk a little bit more about that, I believe, in the next slide. No, we're going to talk about therapy instead. So, Linkages has consistently demonstrated very solid outcomes in terms of clinical measures of success. The outcomes exceed the benchmark median and reach or surpass the 75th percentile. And so the national average rate is somewhere in the 70s, low 70s. But across all these three measures of improvement, recovery rates, and again, an improvement in severity of symptoms, all of our providers consistently are outperforming those national averages. So I just want to make sure that you're aware that your investment is paying off. And you have more data here to look at. I'm not going to speak to all of it, but just to point out that in terms of the investment that our executive and you made in making sure our provider agencies had additional resources to recruit and retain multilingual staff, we have 44% of our therapists now speaking a language other than English, and that is a mission critical component of the work given the diversity of our student population. Next slide. Now we're talking about care management and community partnerships. In terms of the family care management component, about 830 households are served per month, and the family care managers connect with those families in over 3,800 sessions per month. So, this fiscal year, for example, in FY26 through February, these staff have served over 1,100 households and provided over 29,000 sessions. In terms of the services, again, it's needs assessment, it's goal setting, it's linking to all the local and countywide and state resources. It is very direct support, filling out applications if need be, helping with literacy, language barriers, all of the above. With obtaining legal, healthcare, and employment and other resources, it's transportation, translation, and childcare support, and of course being a conduit between our Office of Eligibility and Support Services to promote self-sufficiency. You see outcomes from client satisfaction surveys there as well that continue to have very high results in the 97, 98th percentiles. Next slide. Bridge to Wellness, as I think most of you know, was launched in fiscal year 2023. So as opposed to the Linkages Learning Initiative that's been in place for over 30 years, this is one of our newer initiatives that was created in response to the post-COVID rise in student behavioral health challenges. So it also provides therapy and care management and youth development at all the high schools in the county, 19 that don't have a high school wellness center. And so here you have some data to reflect on. We do have 3 providers that perform this work in different schools across the county. And I'm going to go to the next slide to speak to more outcomes that are really quite impressive. So again, exceeding the benchmark median across all measures in terms of the therapy that's provided through Bridge to Wellness. And all the measures, the approach surpassed the 75th percentile, and that's really especially strong, this result, given the high acuity post-COVID of the population being served. We have to put that in context, and that's very important to highlight here. Next slide. In terms of care management and youth development, the Bridge to Wellness care management, of course, is much more student focused because we're working with high schoolers. We're there to support the student and the family, but there's a lot more direct interaction with the student as opposed to the elementary level. And with those students, 71% of the clients increase self-sufficiency after 6 months. There's a matrix that's used to assess that impact. Next slide. In terms of satisfaction and best practices and partnerships, we really just are excited that, of course, this is a best practice model that we were able to stand up very, very quickly. And I have to acknowledge Kirsten Anderson here in the audience, administrator for Linkages Learning and related many other services, including Bridge to Wellness, and Brittany Taylor, who's a senior administrator for Child and Adolescent School and Community-Based Services, in my former position for just bringing all of these initiatives to a much more mature point at this point in time. Since I highlighted some of these during the youth safety presentation last week, I'm going relatively quickly. I'm not speaking to every point. Happy to answer questions. School and Community Youth Services is now a contract that exists for us with only the city of Rockville. It's a partnership specific to the city. And here you've got the 3 schools named that the city delivers therapy services and prevention services for students at, and community groups and mentoring. That's Twinbrook, Earlby Wood Middle, and Julius West Middle School. So this is a small and mighty team that's comprised of a licensed therapist and youth development specialists. And there you see the information about the services they've provided this fiscal year to date. This is work they have been doing for over 50 years that was originally established through local law enforcement funding, oh my gosh, in the early 70s to reduce youth involvement in the juvenile justice system through prevention and therapy services. And it's work that I know well because it's the work that brought me to Montgomery County in 1999 because I did that exact work with the Gaithersburg Youth Services Bureau as a young, scrappy social worker and clinician myself, right out of grad school. Now I'm dating myself, I know. Okay, moving on to the next slide. Therapeutic mentoring is, again, an exciting new set of services. This is where the funding that previously existed in school and community services across the rest of the county was converted to, and it's a better fit for what our youth need at this point in time. This is open to any youth who lives in the geographic area of any of 21 high school clusters served, but no school enrollment is required, so it can be to support a youth that is not enrolled in school. These services are school and community based and very flexible. They're available after school and on the weekends, and they do prioritize middle school students in acknowledgement of the fact that we have fewer resources on site at a lot of the middle schools compared to high schools and elementary schools at this point in time. So these providers, we have 2 providers doing this work, JESSA currently in Identity. They conduct community outreach, especially again to the middle schools and certain focused middle schools. They do that one-on-one therapeutic mentoring. They coordinate with behavioral health providers if one exists or if one is needed for the youth and family, and they conduct youth development activities in group fashion as well. Next slide. This is just information about what's happening with that service to date. Again, it was just launched in this fiscal year, so these are early numbers because this initiative is actively growing. But again, the youth they prioritize for the service are uninsured or underinsured. They're experiencing barriers to accessing mental health support. And I think I already spoke to the middle school focus quite a bit. The final slide is about the Community Supports Partnership Hub status that our local behavioral health authority is formally gaining in fiscal year 2027. So it's exciting to to let you know, as I did at the youth safety session last week, that we expect about a 40% increase in funding for those additional school-based behavioral health supports that are awarded now. They would be awarded through us, through the Office of Grants Management, previously through MCPS, to provide services focused at schools that do not have other on-site behavioral health services. But these are true behavioral health continuum supports from prevention through intervention, including substance use prevention and intervention services. The final award announcements are expected in late spring. That's it. Thank you.
All right, thank you for the presentations. You all have been doing a lot of good work consolidating services for our children, youth, and families. And it's exciting to hear that this is a full circle moment. Didn't realize you started at the City of Gaithersburg. So very exciting to see how far you've come and how much has evolved under your leadership. So thank you for staying the course. We have quite a bit of items before us to discuss. I didn't know if we wanted to start with those items at the, okay, yeah.
Sure, if there are no questions from the presentations,
No,
we can
not
definitely
this time.
start.
One question real quick about the program. It's just that it's not budget related.
Oh, okay, yes.
Yeah.
Go ahead, Councilmember.
Just before we dive into the budget, because I don't want to ask this in the middle of going through the different items, but thank you so much for the overview of all the different programs. And I know there are a lot of things within HHS to be managed that all work together to help our children and our families. But the one thing I was wondering, especially since there's different pathways to how the work gets done, whether it's directly by HHS, whether it's via contracts, via grants to different entities. So within the Lighthouse Initiative, and since it's a grant-based program now, approximately how many different grant awards are made that then have to be managed as part of the Lighthouse Initiative?
Sure. So we have one grant award that goes out to what we call an umbrella grantee. And as conditions of the grant, that umbrella grantee is required to work with smaller community-based organizations. They do submit their budget for what they plan to budget to those smaller organizations, but we have just one contract with the one umbrella vendor.
And then my other question is for all the different contracts or awards that go out for the work that is done. And we spent time dealing with the backlog and background checks for MCPS, right? Mm-hmm. And so my question is, again, since a lot of these services are dealing with children, whether the individuals who are in the sub-grantee category or the grantee category or the contract category, are they subject to the same background checks and disqualifiers as what would apply to those inside an MCPS school?
Hi, Mark Hodge. I'm the Chief Operating Officer for the Department of Health and Human Services. Yes, so each of our contracts that are direct service contracts that it's not even specific to children, but all of our contracts that are direct service providers have a clause in there that require each of their employees to have background checks. And then we, as the contract monitor, can do spot checks randomly to make sure that is all there. HHS is in the process of updating all of our background check policies just to make sure we don't get in the place where MCPS was. And it includes strengthening our contract background checks. And so that's, we do that now, but it will be even stronger in the next month or so when we get that out there.
And then if an entity that's been performing work, let's say you do a compliance check and something's wrong, and obviously it needs to be dealt with, but are they precluded from receiving an award in the future or a contract in the future based on failure to comply with that?
Potentially. I mean, what we do with contracts now is if we find an employee or the vendor did not or partner did not fire or terminate or do something with that employee, that we would have a conference with them. We would provide a cure letter. It's an official contract term that says that we will not, that they have a certain amount of time to address that issue, and if they don't, then the contract ends. So it doesn't necessarily preclude them from getting contracts in the future, but it does put the onus on them and knowing that we'll be checking. There is, I don't think I'm jumping the gun too much, but OIG report for Treehouse looked specifically at how Treehouse is doing their background checks,
Right.
and so we're good with that.
Right.
But it did bring to light why, and part of the reason why we are improving our background check policy for the department to make sure that those things are happening. Treehouse did nothing wrong.
Right.
I just want to make sure that that's clear, but there is the possibility that we could get in this position, and so we would work with procurement and with county attorneys to address that as quickly as possible.
Thank you for that. And yes, and my question wasn't based on the Treehouse report. It was based on the ongoing, follow-up with the MCPS background check and making sure, especially since a lot of these services are delivered by HHS or through HHS contracts, but at MCPS facilities or through MCPS facilities, that there was parity between them.
Yeah, and additionally, our MOU, HHS's MOU with MCPS has very clear standards that MCPS expects for anybody that's working directly in the schools. So while we have lots of contracts that work with youth in the community, the providers that are actually in the schools, there's an even higher level of expectations because that's what MCPS is requiring.
Thank you, Councilmember Lukey. Great question. And thank you, Mr. Hodge, for the response. And we will get back to the agenda. Thank you.
All right. So again, just stating for the committee's information that we will be reviewing the entire budget for the Children, Youth, and Family Services area except for early childhood services. And the executive has recommended a total of $52.7 million of $56.1 million for Children, Youth, and Family Services. We will also be reviewing the School Health Services Program area under Public Health Services, and the executive recommended a $52.7 million budget for fiscal year 27, as well as the School-Based Mental Health and Related Services Program area, which has a recommended of $26.9 million for fiscal year 27. I will note that the executive only recommended changes related to Children, Youth, and Family Services and the school health services area for the committee's discussion today. There were no specific recommended changes for the school-based mental health and related services program area, except now we have the memorandum from Councilmember Katz related to linkages to learning that would relate to that program area. So I would like to invite our partners at the Social Services Office to the table, please, as we will be reviewing an item that the HHS Committee did discuss originally during the April 20th HHS Committee work session for the Social Services Office. That is a new separate service area within HHS that originally was housed under Children, Youth, and Families. And as they were undergoing the reorganization, the first item, which is an enhancement for 2 contractors to provide MCPS protective service clearances, as Councilmember Lukey was just discussing, for $160,000, is currently placed under Children, Youth, and Families, but does reside in the Child Welfare Services Office in Social Services Office service area. So we are discussing it here to keep consistent with the executive's recommendation, but please note that this item actually is aligned into the social services service area and not Children, Youth, and Families. So as the council knows, on September 26th and November 21st of 2025, the audit committees reviewed and had a briefing on the Inspector General report review of MCPS background screening office, with one of the main findings of the report including that not all MCPS employees underwent a child protective service clearance. As part of the CPS or child protective service clearance procedure, MCPS's background screening office coordinates with the county's Department of Health and Human Services Child Welfare Services Office, including state CPS personnel to provide the CPS clearance process for MCPS employees. Originally, the DHHS Child Welfare Services Office had 1 full-time MCPS merit employee and 1 contractor funded by MCPS to focus on MCPS CPS clearances prior to the report's release and prior to September 2025. To address the findings in the report, MCPS transitioned from paper CPS clearance forms to the Maryland Think online portal, which reduced the processing time from 4 to 6 weeks to 5 to 10 business days. In addition, DHHS hired 6 additional contractors in September 2025 to complete the backlog of paper clearances from MCPS. And as we stated in the November session last year, as of November 3rd, 2025, all paper clearances were completed. And at the same time, MCPS removed their full-time merit employee from the DHHS CPS processing team in November. However, DHHS maintained the 7 contractors, the 1 existing plus the 6 additional, through mid-February. Now there are 3 contractors supporting MCPS CPS clearance requests, the one existing contractor plus 2 additional that they hired to deal with the surge in MCPS CPS clearance requests. So while MCPS does not expect future surges in clearances, DHHS has identified the continued fiscal year 27 need for 2 additional dedicated contractors, that 1 existing contractor plus the 2, as I mentioned, to continue to focus on MCPS clearances based on submitted requests from February, March, and April 2026. Table 6 at the bottom of page 9 and the top of page 10 provides the monthly number of applications submitted, the number of applications processed, the type of application, the number of staff that were reviewing the applications, and any additional notes from DHHS that we discussed just now. DHHS states that without the fiscal year 27 funding for the 2 additional contractors, only 1 individual would process the clearance requests, which is not operationally sustainable and would result in potentially significant backlogs, especially during high volume periods and when the contractor may be out on leave. That could lead to delays in hiring at MCPS and related subsequent effects. And did just want to highlight again that the table does provide that detailed information that Councilmember Friedson requested last time at our April 20th session. This item would be placed on the reconciliation list per the Council President's budget approach. And again, just noting that if the Council were to approve this request, to recommend shifting the enhancement into the Child Welfare Services program area rather than in Children, Youth, and Families.
Thank you, Ms. Rodriguez Hernandez. We're going to pause here for some questions, and I'll start with Chair Jawando.
Thank you. Yes, thank you for the overview, and thank you to your team, Dr. Mensah, for clearing so many so quickly in dealing with that, and that's obviously not what we wanted to have, but you did it really well, and you and your team and these contractors. I guess my question is, how do you see this as ongoing need, or is it something you just need to kind of just catch up and then it could settle into a lower amount, or I just want to understand that based on, I know there's different times in the year when it goes up and down, but once the backlog is done, what's the ongoing need in your view?
All right, good afternoon. Oscar Mensah, Social Services Officer for Montgomery County, and thank you for the invitation to add more information to what we presented last week. Councilmember Jawando, the question is, right now we have to really use this number, the number of 3 brokers that we have, to really steady the trend for the upcoming fiscal year, to be able to see what is going on, to be able to kind of really ask for a permanent need. Presently, from mid of February, we used 3 staff to be able to perform the current digital applications that are coming through. March, we had to do the exact same thing, and we're doing the same thing in April. So we're gonna have to really maintain these 3 staff in order to be able to really have an understanding of what the future need is. But for now, really resorting to these brokers will be something that is really required for us to really prevent us from being where we were a few years back.
Falling behind.
Yeah.
So technically, one time in the sense of you're not sure what the need would be. You'll need to assess that as you go through. Is that what I'm kind of hearing?
You are correct. For the past 3 months, it is established as a need for the upcoming fiscal year. So for this year, yes, it's a one-time only, but we're going to be before you with the data to show, is this an ongoing need, or is this something that we have to reduce, or is it something that we have to really increase? But for now, the situation that we are in, we definitely need this.
Okay.
Yeah.
And if I can just add real quickly, one of the reasons why we did this as one-time only funds for brokers as opposed to coming before you and asking for 2 FTEs or 3 FTEs is because we don't know yet.
Yeah.
So this allows us to be a little more flexible. And then when we come back for FY28, we will have all the data we need to be able to say we need 2 FTEs or 3 FTEs or whatever we need because we use this year as a data gathering year.
Thank you. Obviously, important investment, and I support putting it on the list. Thank you.
All right. I just had another question. I know a lot of the reorganization is making a lot of shifts. I noticed in the packet it mentioned the HHS CPS full-time employee was removed from the processing team. Was this a transfer, an in-house transfer? Was someone let go, or?
I believe you are referring to the full-time MCPS merit employee. Around November or so, we did get information from MCPS that staff has to be removed, and that staff was really performing the CPS clearance. So we actually left with only one broker that MCPS funds, in addition to the 6 new brokers that we added. Yeah.
Okay. Was this associated with the backlog, or was there?
It has nothing to do with the backlog,
Okay.
and since it's a different agency, we couldn't really ask for details, and they've been really funding this employee for years. And it wasn't an employee that we had to supervise, but it was an employee from MCPS, so they really had to make a decision what they really needed to do with the staff. But in terms of the permanent broker, they've really funded one permanent broker for the past few years.
Okay, and the contractors, you are directly supervising the
Yes,
people
we are.
performing the.
Exactly, yeah.
Okay, good. All right, so if there are no objections, all right, so we'll add it to the rec list.
All right, so now I will ask our school health services team to join us at the table as
Thank
our
you.
child welfare services and social services team steps off. The next enhancement is related to reduce the nurse management staffing ratios for school health services for at $340,055. This was an item that was also included in last year's budget and that was funded and approved by the council as well. So the department's school health nurse managers are responsible for managing and supervising school community health nurses and school health room technicians in Montgomery County Public Schools. And school health nurse managers assure that the provision of health services comply with state, local, and professional requirements, review, analyze, and report data, collaborate with internal and external partners and agencies to identify and resolve issues, interpret policy, recommend changes, and serve as mentors and a teacher to their direct reports. They also serve as substitute coverage if there are individuals who cannot serve for that day due to illness or being out on leave. In addition to these responsibilities, the nurse managers also oversee 1 to 2 programs each, for example, the Teen Pregnancy Prevention Program, or monitoring the certification and licensing for school health room technicians as well. So as noted before, the executive recommended and the council approved the addition of 3 nurse managers in the FY26 operating budget. Currently, 16 nurse managers oversee 395 merit school staff. That's 165 merit school nurses and 230 merit school health room technicians. DHHS notes that the current policy for school nurses is 1 nurse per high school, 1 nurse per middle school, and 1 nurse per every 3 elementary schools. However, each community school requires 1 dedicated nurse, and MCPS has identified a total of 80 community schools for the 2026 to 2027 school year. DHHS states that the Association of State and Territorial Directors of Nursing recommends a nurse manager to nurse ratio of 1 to 8. The executive's recommended addition of 5 nurse managers would reduce the existing ratio from about 1 to 25 to about 1 to 19. Council staff notes that the new nurse manager positions include a 6 months lap, as noted in the enhancement title, and the annualization for fiscal year 28 would be $340,055 for all 5 positions, or $68,011 per nurse manager. And this item would also be placed on the reconciliation list per the council president's approach.
Without objection.
All right. The next item is to continue Head Start contractual nurse staffing to annualize the fiscal year 26 supplemental appropriation. So on February 24th of this year, the council approved the executive's request for an operating budget supplemental appropriation totaling $252,274 to supplement reduced funding in the federal Head Start grant to fund 5 contractual nurses for the county's Head Start program at 9 schools. DHHS restates that without the funding, students may experience a reduction in required services, which could also place the program at risk of noncompliance with Head Start performance standards and early and periodic screening and diagnostic and treatment requirements. So this request annualizes the approved supplemental appropriation and would also be placed on the council president's or on the reconciliation list per the council president's approach.
Without objection. Thank you.
Okay. And I'll turn to my colleague, Ms. Clemens Johnson, for the next item.
Good afternoon, Tara Clemens Johnson. We will start with item 1.4. So this is a request from the county executive that the council received on April 21st. This is a requested enhancement for the rapid response hotline. I do want to provide some context. And so this would be a request for new contract funding for the CASA's rapid response hotline. I will go through the narrative to describe a little bit about what the hotline does, but I do want to acknowledge that in a previous HHS work session, there was discussion about the minority health initiatives and a reduction of $537,562 for the information line that was managed by through the LHI contract. So this vendor and the previous and the LHI vendor operate both hotlines. And so what we found is that through our conversation is, yes, there was a reduction needed to that contract because they were underutilizing the contract services, but they were also covering some of the contract services to our understanding under this line. So they operate 2 information lines. One provides a more enhanced support for immigration services, as we will detail in the packet, and the other one, it just wasn't being as utilized. So this funding is to request a new contract for $151,610 to support this line. But I will note that the committee also requested to add to the reconciliation list 2 tranches of $268,781 to help support the line that was recommended for reduction. So a little confusing, so we will talk with our DHHS colleagues and decide where the council wants to land in terms of funding for these 2 different information lines. Again, the reconciliation list, you all added money back to support those 2 lines, and then there's requests to support this line as well. But I would say that all of that funding isn't needed, which would be around $750,000 maybe. So, so we can certainly have that conversation.
Yes, we should have that conversation. Did HHS staff want to share anything about the contract?
I'm curious about what your questions are going to be, so maybe I'll wait for those.
Okay, all right. So I just want to have a better understanding of who's actually overseeing this triage line and how the duties are being assigned, evaluated, and why the new change.
Sure. So the original information line that we talked about last week,
Yes.
that has a decreased number of calls, is really just an information line. It's open. It started during COVID. It was very important, very well utilized. As we've gotten further and further away from COVID, that use of that line has decreased. That is an LHI contract. I believe it is with Identity.
Yes.
And that's what we had put up for reduction. This rapid response hotline is more specific to immigrants who are needing immediate assistance, and so maybe it's related to ICE, maybe it's related to immigration needs. But that contract was being utilized or was being implemented by CASA. Now that we diminished that or reduced the other contract, this one went away. We did talk to Identity about the rapid response one kind of automatically went away with that reduction. We did ask Identity about including that amount in the next through Lighthouse, but that money is already accounted for, and so that's why the county executive has asked for this amount of money for specific to CASA as a new contract. Kind of by itself. It's not connected to anything else, but a unique contract for CASA as a non-competitive contract to provide that service.
Okay. And they are going to just be an all calls sort of hotline for anything related to any needs?
I think potentially, yes.
Okay.
I mean, I think with any hotline, you end up getting calls for lots of other things. But the focus of this particular line really is for immigrants who are experiencing some sort of crisis, or those who may need immediate assistance. Hence the rapid response name of the hotline. But it's potential that number is out there. Someone's going to call for some other reason, but generally we are expecting to use it for the rapid response.
Okay. And so are we publicizing this number on all of our public facing websites? Nothing's changed as far as how we're sharing this number with anyone?
No, nothing's changed about how we're sharing it. No.
Are there any other questions about this?
Yeah.
Oh, go ahead.
So just to put a fine point on it, I mean, I don't see, these aren't new programs. This is something that's been happening. It's a critical need. Just to your point, Ms. Clemens-Johnson, just so I'm 100% clear, which line should we be funding? This line or the other line?
This line.
Okay.
The rapid response line.
Yes,
the information line is what we put up for reduction in the FY27
Perfect.
budget.
Okay, I just want to make sure. So then
Yes.
we'll have to fix that. Okay, great. And then, and if it weren't to be funded, I always like to, what would the impact be? I mean, I just want to underscore that too, because this would still need to go on the rec list, and I just think we need to talk about what the impact would be.
That is council stance understanding as well, because this is a new contract, and currently, to my understanding, the rapid response line is operational and provides services. And so this being a new contract, new funding, I'm not sure if we are filling a gap with this $151,000 because it is currently operational, as far as my understanding is.
All right, so I see our ACAO came down. If you could help us.
Yeah, Luisa
understand
Cardona, Assistant Chief Administrative Officer. So this is really a movement of funding that we should have done on the back end, but we didn't catch it quickly enough. So with that reduction, we were seeing as the funding for the health hotline was also supporting the back end staffing for the rapid response hotline for immigration detention and reporting of ICE. Once LHI was reviewing, they said, hey, there's this reduction in calls, we should reduce. Once we learned more information that, hey, this would impact rapid response because the same back-end support, what the contractor has noted to us is they would have to let go of some staff and be able to take less calls for the rapid response hotline. Okay. So that's why we're saying move the 150 now to Children, Youth, and Family Services, which houses Lighthouse, in order to have more of a comprehensive approach within Lighthouse for immigration detention and not mixing the health hotline and the rapid response hotline.
Okay. So does that have to be on the reconciliation list then, if it's a movement of funding?
I think it does because we didn't catch it quickly enough.
That just needs to be understood by people when it goes to full council, that it's not, like, if it were not to come off the list, it would be a reduction in what's something that's currently happening.
Correct.
I just think that everyone needs to understand that, which obviously would not be good. So, okay.
I also just want to be clear about, with the reduction of the $537,562, which was added back in 2 tranches by the HHS committee, is that it was stated that this money was connected to a contractor, which was Identity. So it would not be funding Identity; it would be funding the line at CASA. I just want to make
So the contract funds the LHI contract. Funds Identity and the CASA Health Hotline.
Both. Okay.
Yes.
Got it. Okay. All right.
So Ms. Clemens Johnson. Given sort of some of the back and forth and what I deemed confusion on Thursday about what was restored to the reconciliation list, which would have in that committee session been a reduction, which would have in this instance been added as a to Councilmember Jawando's. It does go on the reconciliation list, but probably needs an asterisk showing that it was tied to a reduction somewhere else, except that because of the action the committee took on Thursday, it is now more complicated than that, right? Because we didn't put a reduction on the reconciliation list. It got put back as 2 tranches of addition.
Correct.
Instead of reduction.
Correct.
So is it possible before this goes to full council for you to be able to give full council a memo explaining that and really methodically walking through that so that we can fix the challenges that have occurred and so that everybody's on the same sheet of music? Because I heard our folks from the Latino Health Initiative trying to explain the why of why this was, and we were, told, hey, we're going to take the Lighthouse Initiative on Monday. It's coming. We're just not there yet. And, just by virtue of how HHS hearings during budget go, there's a lot of moving pieces, and sometimes parts that are tied together don't happen in the same meeting. And I think we would have had less confusion had those 2 pieces been in the same meeting, right? Yeah. So we have an opportunity now to get it fixed when it goes before full council. And so I am asking pretty please, can we do that? Because that's what I think is desperately needed in this case. And I support the budget item 1.4 on page 12 and adding that to the reconciliation list, of course. But I think there's a lot more clarity and explanation that needs to be provided to full council so we work this all out. Thank you.
Yes, understood. Council staff will provide that detail in the packet.
All right. So are we ready to?
I think there's just a vote needed on 1.4, whether the committee is in agreement of it or not.
Yes, we're all in agreement.
Okay.
Oh, okay. I thought he said he had one. Okay. Thank you, Ms. Clemens Johnson. You coming back, Nicole? All right.
All right. So the next few items for the committee's discussion are related together, and I will try to hopefully walk us through each of them so we can understand the situation. So similar to the Rapid Response Hotline, on April 21st, the county executive transmitted an operating budget adjustment for an enhancement to continue the department's administration of the Saturday school tutoring services at George P. Thomas Learning Academy, totaling $722,579. Just for information, the George B. Thomas Learning Academy, also known as Saturday School, works in partnership with Montgomery County Public Schools to support youth education and academic achievement in the county. The executive director of the program is an MCPS employee, and MCPS has dedicated 1 FTE to support this academy. And the academy's courses provide academic tutoring and instruction with certified teachers in a nurturing and supportive environment. That's the quote from the program. Individuals must pay for the courses. For example, MCPS students in grades 1 through 12 will need to pay $85 a year or $40 a year for FARMS recipients for courses focused on reading, language arts, math, or core subjects. As the administrator for the funding to the George B. Thomas Learning Academy, DHHS has specific performance outcomes that they expect, including students showing improved knowledge and skills in reading, math, language arts, and test takings, as evidenced by their GPA improvement. The students receiving mentoring that supports creativity, problem solving, resilience, confidence, and decision making, informed by surveys. For younger participants, they must show developmental improvement based on the child outcome summary and demonstrate kindergarten readiness, as measured by the kindergarten readiness assessment, and students must attend more than half of the scheduled sessions. And just for your information, the table 7 on page 14 to 15 provides you a history from fiscal year 19 to present of the targeted number of students, the number of students enrolled, the budget that has been allocated to them by the department, how much was actually spent, the percentage spent, and the remaining funds. And just noting, of course, we're still in fiscal year 26, but the contractor expects to utilize about 80% of the awarded funds in fiscal year 26. So the executive transmitted originally on the March 13th transmittal to the council 2 reductions associated to the George B. Thomas Learning Academy. Point 2.2 shows a reduction to right size the George B. Thomas Learning Academy contract to the level of services provided, which is a reduction of $190,000 and $153. As you'll note from the table that I just mentioned, that compares to the amounts, the range of the amounts remaining from fiscal year 19 to fiscal year 26 from about, I believe it was $125,000 to $211,000. So the $190,000 is what was remaining in fiscal year 25. So that was one reduction to right size the contract based on actual level of spending, which we've seen throughout the department's budget in multiple occasions. However, the second reduction, 2.1, was identified as a shift for the Saturday school tutoring services at George B. Thomas Learning Academy to MCPS to administer these services. And that was a reduction of $722,579. And that is the same amount that the executive transmitted on April 21st to reinstate. So essentially, the department and the executive had recommended eliminating the entire contract with the funds for George B. Thomas Learning Academy. As we'll discuss now, item 1.5, which would go on the reconciliation list per the council president's budget approach, is to reinstate the right-sized or level of funding for fiscal year 27 for the George P. Thomas Learning Academy. So we had a contract, the executive recommended right-sizing it to the actual level of spending, and then ultimately also recommended reducing the entire contract amount, and is now requesting to add the enhancement back to the right size leveled amount for DHHS to continue administering the funds for the Saturday school. So, as noted, the executive had stated that the reason for the reduction originally was to optimize the scope of the contract and transfer responsibility to MCPS, whose mission and expertise allow it to most effectively provide these services. The department states they are not structured to oversee or deliver educational interventions, as its mission is centered on health and human services, not academic programming. In addition, DHHS states the proposed adjustments related to academic interventions supports the county's broader strategic goals by ensuring that services are delivered through the most appropriate systems of care and reflects a commitment to aligning resources with agency mandates to optimize service delivery for youth and families. However, with the transmittal on April 21st, not March 21st, with the reinstatement of the funding for the right size contract, it's to continue to provide this, the executive states it's to continue to provide this important service while exploring the best ways to transfer this function to MCPS and develop a memorandum of understanding with MCPS for an eventual contract shift from HHS to MCPS. The council staff did not originally receive confirmation that MCPS was prepared to fund and administer the services. However, as noted in the executive's request in discussions with MCPS, they state that they would not be able to absorb those services and fund and administer these services at this time without the proper planning through the memorandum of understanding and further conversations with the department to continue these services and in the future to be administered by MCPS potentially. So that is the situation where we have right now the 1.5 enhancement that would go on the reconciliation list to reinstate that contract, and then the 2 reductions related to it. So,
thank you. I think we all have quite a few questions about this contract. I remember my daughter used to go to the Saturday school quite a while ago. And so DHHS has always overseen this contract, or that just started recently?
I mean, it started off as a community grant many, many years ago.
Yeah.
And like many things, HHS got it because it didn't fit anywhere else, I guess. And so now it was moved into the base budget 4 years ago or so, when we were moving community grants into the base budget to allow for space for OGM, so Office of Grants Management. So so we've had this for a very long time.
Okay. And so the original scope, was there specific criteria that you were evaluating pre and post participation to evaluate outcomes of participants?
I have some familiarity with this since it resided in the program area that I oversaw at one point. So yes, no, absolutely. Of course, there were academic benchmarks and pre and post tests and all of that. However, I can't speak for the last year and a half. However, there had been a long delay in receiving those outcomes, especially post-COVID and returning to doing this work post-COVID, in part because the analysis was being done within MCPS, forgive me, I'm blanking on Office of Shared Accountability, within their Office of Shared Accountability. And so I know that for a period of multiple years, HHS was not receiving that data on those outcomes.
So you all just continued to fund it, and you weren't sure what the outcomes were?
I can speak to 3.0
Yes,
version of this now. I know that our team has been working closely with MCPS on it, and we are receiving that outcome data. Again, it is all based on what they submit to us, and I think the thought behind this is that MCPS is really in the best position to oversee this work because they have, access to their academic records for their students. They can better probably streamline their data coordination in a more time efficient way than what I think we have seen historically. But we are receiving outcome data for this contract.
Okay, and
I will just, if I can just
go
add,
ahead.
because you did ask if we continued to fund, and this was a contract that was recommended for reduction in various other years as well.
Okay, but then it was ultimately moved into the base budget, which is kind of blind funding. So what's the status of the MOU currently?
Right. So we have been talking with MCPS about this and multiple other things that I'm sure we'll talk about today. They are on board to help create the MOU. Our team has really started drafting that on our end. It's just that there would be no way we could execute that before the FY27 start. So our goal for FY27 is to continue working with MCPS and George B. Thomas to agree on language on the MOU and eventually the transfer of funds there as well to ensure that the work for the Learning Academy continues. On the other side, MCPS also needs to take a look internally to see maybe what other resources or needs they may have for taking this on as well.
Okay, and is this a normal arrangement to have an MCPS staff member oversee a county contract or a quasi nonprofit contract?
So are you referring, I think it's the executive
the executive director who's
right.
also
So they
a
don't
principal,
necessarily
right?
oversee the contract. Our team does that internally. They are just kind of our forward-facing POC with the program itself. So the overseeing of the contract lies within CYF.
Okay. All right, I'll yield and go to my chair and then open it up to colleagues. Go ahead.
Thank you. Yeah, I appreciate the history. I've been along for the ride here for most of it with the Learning Academy, as I know have Councilmember Evans in her former role. We don't want it to end. I'll start with that. So I think we need to support the funding. It is a little frustrating, the back and forth on the budgetary, I could have told you that from day one that we weren't ready to transition it. So we should have just put the money in right away. But it is what it is. At this point, it's just super confusing. Like 3 moves in almost 6 weeks, for just in the public. And so I'm glad to hear today that we're going to keep it in place, obviously with a big reduction for next year, hopefully, and then get an update with MCPS. Is there a timeline that you've set in place for these conversations so that we can?
Yeah, I mean, we've been having those conversations for the past few weeks. The timeline on our end is really to have an executed MOU before the start of the next fiscal year,
Okay, so this is before July 1.
before FY28. I'm sorry.
Okay.
Right.
So obviously this would be for next year. So
Correct.
prior to next, I think we need to move it back even prior to the budget
Correct.
next year. So that would be even earlier than that. But okay, yeah, I mean, my kids have also attended this over the years. There's families that rely on it. The worst thing would be just a discontinuation of service, even though this would be a reduction. So yeah, I support keeping it. And I'm assuming this would be added as a reconciliation item on this list that's too long already.
Yes, it would be added to the reconciliation list.
Yeah. Is there any, since the reduction was recommended of this 722,000, and this would be 190 going on, so it was so technically the 722 was removed, correct?
Yes, so they had, let me just pull out the correct number so I'm not just stating off the cuff. So on fiscal year 26, they awarded $940,113 about. Based on the remaining funds from the past few fiscal years, the executive had recommended that $190,000 and $190,153 reduction to right size the contract to what the actual level of
722.
spending has been.
Got
Yes.
it.
And then, but also recommended the reduction of the full remaining contract amount of $722,579. However, on April 21st, recommending reinstating that $722,000.
Got it. Okay, that's what's confusing me. So we had to take 190, then take everything, now put the 720. All right, so I support the 722,579, which would be the reduced amount from last year, but commensurate with what's actually been spent along with level of service, knowing that the numbers have dipped a little bit post-COVID, which has been an issue. Okay, great.
So I'm glad Councilmember Jawando had some of the questions answered so that anybody listening could understand, because as a former school board member, I was able to see the program up and close. And then, you know what, even going back to prior to serving on the school board, just being a parent advocate and seeing how the George B. Thomas Learning Academy has come a long way in terms of the services they offer to our students. And it's what we consider 6 days of school as opposed to 5. And you know what I do? So, okay, no, but you answered that question. I was going to say, even though there is a reduction of what was spent last year, it just could be as a result of, I don't know, maybe people not being able to participate, and I'm not for sure if those numbers will in fact change, but I just want to be able to save it. So that's the most important thing. And then the executive director is typically a former principal. So you have a former principal leading the academy who has a good bit of wealth of information in terms of how the school system works and how that goes. So very supportive of the program, don't want to see it go, and I hope that it can come off of the rec list. Yeah, it's just kind of dangerous to have it there, but that's all.
Thank you, Councilmember Evans. And just before I turn it over to HHS colleagues, can you explain when they started charging the fee, 84 and the what was it, $84 a year? Yeah, and one other, 85 per year or 40 for the farms. Has that always been cost?
So
associated with the
it's
program?
at least several years ago the cost was there. However, they've always had that reduced rate for those that participate in farms and other sliding scale options based on outreach.
Oh, okay. Yeah, I didn't, just never realized it. Okay.
I was gonna say, I can't answer when it started. I just know it's been there since my kids hit high school. So I could say that with great clarity. Yes, we definitely need to have Saturday school. It is a critical program, but I do think, and I totally appreciate the timing, and that the timing is not aligned for the types of shifts or things that need to happen with it. But I do believe that it's important for something like this and MCPS administers it, and to Councilmember Evans' point, that's important because you need someone who actually understands the inner workings of the school system and the classes and the courses and everything else in order to best make sure the operations of the system are working well. I do think that that perhaps it should ultimately be with MCPS fully to do, but that there needs to be ongoing collaboration with HHS because some of the students who are being served in Saturday school and receiving academic supports there are also being served by HHS, and you want to be able to take a whole child view of things, and so there's value in that. I just think that the program itself is better aligned, since it is an academic support program, with MCPS itself. The other thing I wanted to flag, and I've talked to MCPS about this, but it because of the hours during which it is operated on Saturdays, often conflict, particularly if you have student athletes who may need these services, but then they can't go because they have practice or games that are scheduled at exactly the same time that Saturday school operates. And so, we always focus within MCPS on our student athletes. You're a student first, athlete second. We want to make sure they're supported, but they can't take advantage of things like this. And I'm wondering what we might be able to do to better adapt for that, particularly so that we are supporting those students who participate in athletics year round and also may need academic supports in order to both achieve academically and maintain academic eligibility for MCPS athletics. So just something to flag as you move forward and work through these things.
Thank you, Councilmember Lukey. Councilmember Friedson.
Appreciate it. I don't have children old enough to attend the school and the Learning Academy, but obviously a big fan of George B. Thomas and know how important it is and what a lifeline it is to so many of our families. And I share in the frustration of colleagues. I don't really understand how this happened, and it seems incongruent to me that we could, on the one hand, say we've been working closely with MCPS, and on the other hand, not fund this and not have discussed it and then send over a supplemental. So MCPS isn't here, but could I just get an understanding of what does that mean? How do you both work really closely on this and have a conversation about an MOU and discuss outcomes and all of the things that were said earlier, and at the same time made an assumption that MCPS was going to take over a contract that they've, at least according to council staff, have clearly said they were not prepared to do? It's an HHS question.
So we've had conversations about this for many years. So, and this isn't the only program that we have or contract that we have that does after-school tutoring. And so this is a conversation that we've been having internally with HHS for several years about where does this best fit. And we did talk with MCPS prior to budget decisions in January to see. We know that MCPS, in addition to George B. Thomas, MCPS also offers its own tutoring services. And so George B. Thomas is not the only player in this game. So we had a sense that the students that were attending George B. Thomas might be able to be absorbed by MCPS at that time. And so that's why this kind of continued to move forward. When the decisions were made in the final budget that was submitted in March, there was an understanding that that this would be able to be transitioned over to MCPS. MCPS looked at it and decided that that wasn't something that they could do, and so here we are. We're back. We're kind of where we started. Except this time that we're going to start early and get an MOU in place that just captures all the discussions we've had. And so when the transition does happen for FY28, that everyone is on the same page.
Okay, well, I don't feel like I'm on the same page because it sounded like a few different things there. What I heard was that you didn't think that this contract needed to happen because MCPS already has tutoring programs and the students who are being served by this program could be served by the existing programs. That's a cut. That's not a transfer. That's not a transition. That's different than what we're talking about here, which is HHS doesn't feel like it is within its core competency to handle tutoring programs as a health and human services agency, and is doing a comprehensive effort across the enterprise to look at contracts and other programs that are outside of your scope, which is a conversation that we've had in the HHS committee. But those two things are different. So I'm just trying to understand what was the expectation that was made when the budget was submitted? Was it that this contract would remain, but MCPS was going to take it over, and a synapse was missed and a mistake was made, and the county executive now wants $722,000 for us to, pay for the fix? Or was HHS's belief that this is not a contract that's necessary, period, that MCPS should handle this within their existing resources, and a new decision has been made that we don't want to cut this contract? Because those are two different things. I just want to understand what we're talking about here. I see Ms. Cardona's joined us.
Luisa Cardona, ACAO. Just want to give the perspective from the Office of the County Executive. So when the reviews of all the budget cuts were being made, what was asked of each department for each proposed cut is what will be the impact in services. Very similar to the conversation we're having here today. Who will be impacted by the services? When we initially had the conversations, HHS said, to both of your points, look, this isn't in our core mission, and we believe MCPS can take on the children. So there won't be an impact necessarily completely to the community losing services because MCPS may be able to absorb them. We went back and forth. We said, go check, right? Talk to MCPS. They had conversations. But I don't think it was until MCPS also finalized their budget that they said, we cannot take this on. By that point, we had also made budget decisions. And at that point, the main goal, and I understand, I agree, the back and forth is very confusing and difficult to process. But why the county executive went back on that decision is because we don't want children to get no services, right? We had an assumption. That assumption was incorrect. We should have pursued and had deeper conversations and maybe higher level conversations with MCPS to ensure that they could take this on before it was made. That decision to cut that funding was made. But once we realized they couldn't absorb that, that's why that amendment was proposed, because we don't want children to have no services.
I appreciate that. It's a frustrating failure on behalf of the county executive. I've got to just say that. And people are impacted here. The partners who are doing this work every day, there's a lot of volunteers. There's people who get paid as extra jobs. There are families, most importantly, who rely on this service, who I think are going to be in limbo right now. Was it the county executive's expectation in his budget request for MCPS that these services would be continued with MCPS, or he was saying, you do the work, but we're not going to provide you any resources to do it?
Our understanding is that from HHS conversations, so I'm going to be completely transparent because as the MCPS ACAO who is supposed to have, I did not directly have these conversations with either Dr. Teller or Essie of can you absorb this? Our understanding through HHS is that HHS said they could absorb it in existing services is what we assumed at that time. Agree. We should not have made that assumption, and I should have made that direct call.
Okay, I appreciate that. So the view originally was the executive thought that the George B. Thomas Academy could be shut down, or at least not get county funding to do its work, and that MCPS could handle some of the similar population through their own services. Just so I'm fully understanding.
Yes.
Okay, and then MCPS came back and said, no, we can't within our existing tutoring programs.
Not necessarily shut down, but potentially absorb that same contract within MCPS funding that we were providing as a whole.
Okay, so the executive was assuming that the $722,579 would be absorbed in his request for MCPS. Like that, the thought was that would be absorbed.
That was, yes, an assumption.
Okay, so my suggestion, and I think it's still in keeping with I'm very concerned that if we put this on the rec list, it's not going to get funded. I think all of us have, essentially noted that this is not going to be an easy reconciliation process, very difficult decisions are going to be made. Even things that aren't on the reconciliation list, I think, are going to have challenges given all of the dynamics that we have and the way that this budget was constructed, unfortunately. I think if this is truly a shift of how this was intended to be, the fix of the shift would be reducing the MCPS budget request by $722,579 and funding it. And then it wouldn't be on the reconciliation list if the full council agreed to that. So that would be my personal suggestion. It sounds like that is what the expectation was originally of the county executive. To me, I think that would be the way in which we would ensure that it wouldn't be on the reconciliation list if there was concurrence of the full council. So I would put that out there as a motion to see if colleagues agree with that. But I think that's the only way that we would have an opportunity to not have this on reconciliation where it would have a question until the very end of whether or not it was funded.
Councilmember Friedson has a motion. I know that Councilmember Evans has a comment about, all right, his motion is seconded, so we will continue to discuss.
It is so much fun being on this council. Oh my goodness. Okay. I was going to say a lot of things, and nothing of it was pertaining to the. I'm gonna go in the order that I was thinking initially. So initially, my thought was to come back and just make certain that people listening were aware that the academy is more than tutoring, right? Students go there for test prep, they get STEM education. It's so much more. And so when I was sitting here listening to Councilmember Sales talking about her daughter taking part of it, I was going back to my daughter was in kindergarten, which was in 2008. That this George B. Thomas Learning Academy was in existence, and George B. Thomas was alive, right? And I attended his funeral right down the street at Snowden Funeral Home. And so he just was a great leader here in the county, and I'm glad that this is still in existence. And so then I'm gonna say this, because HHS has housed George B. Thomas Learning Academy for so many years, I'm going to make the assumption and give you all the grace to know how important this academy is, and that there was miscommunication. It's unfortunate that the miscommunication happened, but that's what I'm going to do. I'm going to believe that it was an accident, right? These things happen. This is a tough budget cycle, and so the hard part is we have to do what we say we're going to do right in this moment. What I don't want to do is I don't actually want to reduce the MCPS budget. I don't want to do something that they hadn't thought about, that like they're not here to have this conversation. So I don't know that I want to do it like this, right? So I feel like I'm in a tough spot. I don't want it to go on the rec list, but because there are so many things that we have to decide as a full council that we haven't yet decided to reduce the school system budget by $723,000. While it doesn't seem like a lot, it is when we're in this cycle. So as I think about what I'm going to do, if I'm going to raise my hand or not, I'm gonna let Councilmember Jawando say what he has to say. But
yeah, these are tough
Ms. Cardona,
decisions.
you always come up here. You're always so gracious, and you take all the blame, and I appreciate it. But yeah, this is a tough one. Okay, so
Thank you, Councilmember Evans.
Yep.
Councilmember Jawando.
Yeah, I appreciate that. And obviously, my role as chair of ENC with no one from MCPS here, and we had a meeting earlier today on MCPS's budget. We'll make a funding recommendation on Friday. I wouldn't want to do anything that got ahead of that. I would suggest maybe that the joint committee refer to the ENC committee to have a discussion about this as part of the recommendation. I'm missing a member as well right now. I don't, so I wouldn't be comfortable with that switch at this moment in time, especially not with being able to ask MCPS anything. And also just the overall budget. I mean, the reality is the budget often gets balanced on the back of MCPS at the end of the day. If when there's big items left, and we're going to have a larger conversation, as was mentioned, about not only the rec list, but just the base budgets of many agencies and departments. So I think putting it on the rec list and then, allowing us to have further conversations and explaining the context it'll put it in the mix with other things. But I don't think the other thing with MCPS's budget is we don't have line item authority. We're going to give them a number, a funding number, and they're going to decide what to do with it. This could be something they decide to do with it. It could be not. So it actually doesn't even provide any protection to the money. So I think in that sense, even though this is HHS program, I guess I would want to talk about that a little more. Again, very supportive of this moving forward, frustrated that we're in this position, but I wouldn't be comfortable with making that predetermination on the reduction at this time.
All right, so there's a motion that has been seconded. All those in favor of subtracting the resources from MCPS's budget to guarantee funding for this program? All those in favor? All those opposed? Okay, the motion passes, and we will.
Just would like to note we have a committee member missing who's upstairs. All this is going to be figured out by the full council, but I just
make note that Councilmember Mink was not present for the vote.
Yeah, thank you.
Okay. All right. Thank you, everyone. So this is a moot point for this item if we're moving it to, that recommendation to subtract from MCPS to fund this in the budget and move on to item 2.4.
2.3, yes. So just restating that the enhancement for DHHS to continue funding the George B. Thomas Learning Academy contract at $722,579 will still go on the reconciliation list with the note of the committee's recommendation being 3-2 on reducing MCPS's operating budget request by the equivalent amount to be able to fund it on the DHHS side.
Okay.
And so points 2.1 and 2.2 relate to what we just spoke about, as mentioned at the beginning. And so does the committee concur with the recommendation to right size the contract with a reduction of $190,000?
You're okay with the right size?
Yes. Okay. Just wanted to confirm.
Yes, thank you.
All right. So moving to item 2.3. It is another reduction request for the Washington Youth Foundation After School Weekend Tutoring Program, and as noted in the transmittal, to then transition those participants to the George B. Thomas Learning Academy, and that is a reduction of $62,585. Please note that the item 2.3 is also related to item 2.4, which is the executive's recommendation to eliminate the contracts with the Washington Youth Foundation. This one is for tutoring. The second item is for mentoring. And so just noting that, again, similar to the original reduction with George P. Thomas Learning Academy, it is for DHHS to help refine the scope of their services related to their mission. So they state, while the program offers valuable support to youth, its emphasis on academic and career mentoring aligns more closely with the mission and infrastructure of MCPS, who is better positioned to integrate these services within the educational environment. In addition, this proposed amendment supports the county's broader strategic goals by ensuring the services are delivered through the most appropriate systems of care and agency to optimize that service delivery for youth and families. In fiscal year 25, the Washington Youth Foundation provided after-school weekend tutoring to 190 students with about $60,000 allocated to them. In fiscal year 26, they had about 2,000 allocated to them, and they have served 98 students so far, with the desired outcome that at least 50% of the participants demonstrated an improved academic performance in math and English based on the pre and post course evaluation. And as highlighted in Table 7, DHHS states that the Learning Academy has been under-enrolled and has capacity to serve additional students through tutoring and mentoring, assuming the Learning Academy remains operational.
Does HHS want to talk about the behavioral health component of the contract?
And so for that, we can also talk about 2.4.
Yes, both
which is the
together.
reduction of $92,638, which is the Washington Youth Foundation Youth Care Mentoring Program, with transitioning those participants to existing MCPS services or existing departmental therapeutic mentoring services as presented by Chief Martin. So similarly, they served about 103 students in fiscal year 25 with about $90,000 they were allocated. And in fiscal year 26, they've served 90 students so far with the $92,000 allocated, with outcomes on students' confidence increasing and stronger peer relationships, as well as parent or guardian expressing satisfaction with the services provided. I will note that for both, DHHS did state that they will work with the provider and the Learning Academy and additional behavioral health services to ensure that both parties, the parents and guardians, as well as the new services they could be relocated or transitioned to, would have the contact information as with the permission of parents and guardians as available, so that they can smoothly transition to those new services.
Okay. Do you want to tell us a bit more about how this, I guess, complementary program worked with, is this totally separate from the George B. Thomas Learning Center? This mentoring
Correct.
program?
Yeah, this
Okay.
is a separate contract with a separate vendor. The same vendor offers both the tutoring services and also the mentor services. So for the tutoring services, these classes are weekend classes in math and English. The target population is Asian youth. For the past year, however, the contract has underperformed in that the goal is to reach 290 clients. In FY25, they reached 190 students. In addition, kind of similar to what we see with George B. Thomas, the vendor or contractor is also charging families up to $180 per class. And those items are also on a sliding scale as needed, I guess, depending on the family situation.
Okay. So was there any objection to the reduction?
No, from me.
Oh, okay. Okay. So, one second. On items 2.3 and 2.4, without objection, we are supportive of the reduction. And Councilmember Mink?
Thank you, and apologies, I had a district-specific item in another committee, so just I'm trying to juggle back and forth. If I'd like to reflect my support for all of the line items previously that votes have been taken on, except for the vote that was taken to take the George B. Thomas Learning Academy funding from MCPS. I'd like the record to reflect that my opposition to that motion.
Thank you, Councilmember Mink. All right, 2.5.
All right, so just stating with the 3, 4, and 3 opposed that motion would not move forward.
Yeah, it has to have a majority to move forward.
Go ahead, Councilmember Friedson.
Yeah, I mean, well,
Yeah.
there's two ways to do it. I mean, technically, the vote was taken. The vote was, 3-2, and then the minutes would reflect that the third vote came and reflected. It's like if you miss a vote, you ask to be recorded, saying that you supported a motion, but it gets recorded in the minutes, but it's not necessarily a formal vote. I will yield to those who, presiding over the meeting and staff to determine how that's done, but generally in Robert's Rules of Order, that's how it would be treated. But either way, the full council is going to have to decide.
Exactly, and the record will
Yeah.
reflect, and we can always explain it during the full council. Okay,
Yeah, and
Councilmember
we're in
Friesen?
committee, I could move to reconsider and get a second, and then we take the vote. I mean, but it just should be reflected 3-3.
Wait a second.
It was not we normally don't get to this level at the committee. It should just be reflected. The committee member is sitting here, and she's trying to be recorded for a vote, on an issue substantively. So but I agree with my co-chair here.
Thank you, Mr. Chair. So the record will reflect the 3-2 vote and Councilmember Mink's subsequent vote on the record. And then if more of an explanation is needed during full council, we will share that during full council. Okay.
All right.
Are we ready to 2.3 that we just voted on? Go ahead, Councilmember Evans.
I just wanted to be on the record in opposition to reducing 2.3. That's all for George B. Thomas. I just wanted that to be noted. That's all.
Thank you. Councilmember Evans. All right. So,
All right, so item 2.5.
All right.
It
Okay.
is, the executive has recommended a reduction of $29,503 for the Long Branch Area Green Space and Gardening Program to transition to the competitive Office of Food Systems Resilience grant program. So the Green Space and Gardening Program provided ongoing education on green space gardening to support the well-being of children who were significantly impacted by the COVID-19 pandemic. The department states the program has not been implemented for over a year and a half due to renovations at the site location. However, it is important to note that the executive is not recommending an equivalent increase in the Office of Food Systems Resilience to continue this programming. However, as the executive branch states, instead of the county administering 2 community gardening programs in different departments, eligible organizations can apply for competitive grant awards through the Office of Food Systems Resilience. And to note, while the recommended reduction eliminates the entire funding for this Long Branch Area Green Space and Gardening Program, the executive did recommend a $150,000 enhancement to the Office of Food Systems Resilience for the Food Systems Education Grant Program. Council staff concurs with the executive.
Yes, I just had a few questions. Are we aware of the OFSR's criteria for engaging with the community regarding the criteria for ensuring equity in this allocation of these resources? I don't know if anyone. We can always follow up.
Yes, we can definitely connect with the Office of Food Systems Resilience. For that
Okay, I thought someone from the executive was coming, but we can always, okay, switch your seats.
Hi, Grace Pedersen from the Office of Management and Budget. The Office of Food Systems Resilience administers a lot of different competitive community grant programs, including this one, which are going to be administered by the Office of Grants Management in terms of getting it out in the community and receiving those competitive applications. So we can provide more specifics about maybe criteria that goes into this program, how many people are served, but it generally follows that standard process through OGM.
Okay, and then where the actual garden would be located as well.
Sure, and it will be competitively distributed. It's reconsidered every year with every new pot of funds that's renewed by the council. So it's not necessarily going to go to the same organizations every year, but we could provide prior year actuals and then an update once the FY27 competitive allocations are made.
Okay, but it'll be housed within or limited just to the Long Branch community?
No, it goes into a pool of funding for this, the community gardening program overall, and that's considered countywide and distributed competitively based on the strength of applications received.
Okay, all right, thank you. Any other? Okay, without objection.
The next item is another recommended reduction of $40,000 for the positive youth development gang training to the level of spending. DG just allocated about $100,000 in fiscal year 26 for the positive youth development gang training so that street outreach network staff can participate in certification and training courses related to basic gang and crisis intervention, advanced annual community intervention and prevention recertification, positive youth development strategic planning, crisis intervention response protocol facilitation sessions, and multi-agency community and stakeholder capacity training on community safety. The department states there are no expected service impacts as the reduction reflects the discontinuation of virtual training that was initiated during the COVID-19 pandemic that is no longer necessary. Approximately $60,000 will remain to fund positive youth development gang training for staff. And council staff concurs with the recommendation.
I just had a quick question. How long has that virtual option been? How long did it lapse for? How long has the virtual option not been available?
I'm not sure. I could get back with you though. I'm not sure if it's not available.
Well, I mean, that's what it said in the contract. So I'm just wondering, when did it stop? Because the pandemic ended in 21 and 40,000 has been allocated every year. So I'm just wondering, how long has it lapsed? Like, do we know the last time were any meeting minutes? Who was receiving the 40,000 for this?
I would have to go back and see a date specifically, but I know that since we're out of COVID at this point, the virtual option is not something the team has utilized because they have been doing the in-person trainings.
Okay. So the training's been happening, just not virtual?
Yeah, the training has been happening, just not the virtual option.
Okay. All right. So without objection?
Okay. The next item is a decreased cost of $80,000 to eliminate funding for substance abuse contract at the youth opportunity centers that has expired. DG just notes that the recommended reduction is due to previous performance-related issues with the former vendor of this contract and the duplication of services provided by Identity, Inc. under the Behavioral Health and Crisis Services service area. The department does not expect service impacts from the expired contract as Identity, Inc. is prepared to provide these services as well. And Table 8 on page 18 through page 20 provides you the highlights of the fiscal year 25 and fiscal year 26 outcomes and outputs from the related services provided by Identity, Inc. And council staff concurs with the executive's recommendation.
Without objection.
The next item is a reduction of $133,523 to reduce after-school programming to the Carroll Ave/Quebec Terrace neighborhood and transition participants to Excel Beyond the Bell and MCPS high-dosage tutoring services. The executive's recommendation would eliminate the contract for the after-school programming with the YMCA at the Carroll Ave/Quebec Terrace neighborhood location. The contract provided academic support and enrichment activities for 4 days per week for 22 students, or 36 if you include their summer programming. The contract elimination is in alignment with the executive's other recommended reductions to refocus the department's scope on health and human services and not educational interventions that they believe would be better served by other providers such as MCPS or recreation. Table 9 on the page 21 provides the allocated funding, actual spending, number of youth served, demographics of the youth, and the cost per participant from fiscal years 23 to 26. And DG just states that the YMCA will transmit the current participants' contact information to the New Hampshire Estates Elementary School's Excel Beyond the Bell program and to MCPS's community school team with permission of the guardians and parents to help transition the participants to those related services. And they will also, of course, the parents and guardians will receive the EBB or Excel Beyond the Bell and MCPS community school contact information. DHHS states the New Hampshire EBB program is not currently fully enrolled and has the capacity to absorb additional students next year. However, did want to note the executive did not recommend additional funding for EBB programs in the Department of Recreation's fiscal year 27 recommended operating budget this year. And council staff concurs with the recommendation.
Chair Jawando.
Yeah, I appreciate it. This is my home neighborhood, and I know these kids. I've been to this program. It sounds good on paper, but I'm a little bit concerned, given our previous discussions, that this handoff is going to happen and these kids actually get enrolled in the program. And I don't know why, and I'm particularly frustrated now because of what's happened, that we don't have MCPS here.
Yeah.
And I don't know if there was an invitation extended. They were here with us this morning. They were doing meetings in the building. So I want to know more about what conversations have happened if we're going to eliminate a program that's serving youth in Quebec Terrace to ensure that they are handed off
Correctly, equitably.
Sure, I can speak to that. So our program team and MCPS has actually met to discuss a transition plan. There are 27 students that will need to transition over from this contract to EBB or another program within the school. But we have had those conversations. MCPS has agreed to work with us to transition the students. Of course, there's no guarantee that a family or a student will go to another program, but we will share the information and work together to ensure that the families and the students have the option and the information available.
And who is when you say who at MCPS are you working with on this, or who is working with whom?
So it's our program team directly working with the in-school team there.
At New Hampshire State's.
Correct.
Okay, and they have capacity to absorb 27 kids?
They have confirmed that, yes.
Okay. I just want to, I want to follow up offline. Before we make a final decision, I'd like it to be brought up, and I'd like someone at full council to have MCPS. I'd like to have MCPS there so that we can confirm it on the record, or you can follow up in writing or whatever. I just want to make sure we've got this where we need to get it.
Sure.
So, all right, thank you.
Thank you, Chair Jawando. Councilmember Friedson.
Thank you. Yeah, I appreciate HHS trying to do what I was talking about earlier, which is to determine what your mission is and try to focus on what is the mission of Health and Human Services and how do we focus on that, do what we do it as well as we possibly can, and ask other partners to take on the other responsibilities which are outside of your core mission and your core scope. So I appreciate that. I want to acknowledge that. I think that's what the intent is here. I think the frustration is that we have to make final decisions that are binding decisions, and it feels like we are making them off of ongoing conversations that are happening, but not that happened, and not decisions that have been made, not handoffs that are ready to occur. And so it puts us in a very difficult position to make a decision when it seems like the conversations are still in process. So it does feel like we're being asked to make a final decision when the process has not yet been finalized. Where, identifying the 27 families, the discussion with those families, and if 20 families said they want to go to another program and 7 families declined and said they had other options or preferred other things or it just wasn't right for them, then we can make a decision based on that of whether or not we're comfortable with that, or whether it's all 27 or whether it's 0, and whether or not we're comfortable with that. But I don't feel like the responses to where we are on these decisions are up to the standard that I would expect based on the decision that we're being asked to make. So I just want to note that. I think it's a very difficult dynamic, perhaps by the time full council takes that up. And I think that's a shared feeling. We might have slight disagreements on certain aspects of this, but I think you're hearing that frustration from each of us. So again, I appreciate the goal here. I think the goal is a laudable one, to protect your team, to ask your team to do what is in their job, what is in their mission, what is in their core competency. But I do think the transition and the conversations have left some synapses that feel like they have not connected and have not been completed. And that is a challenge for us in order to address those issues. And if the decision is final and you made it based on a certain thing, I think, the county executive sent over his recommended budget, own the decision. And then we can grapple with whether or not we agree or disagree with this decision. But it seems like there isn't a final decision. There are ongoing conversations that may or may not come to fruition. And it makes it very difficult for us without a binary dynamic of here's what we decided to do and how we're going to do it and what's going to happen when you make this decision. Right now, it's we're hoping that this will be the outcome, but we're not really sure. And that's a very difficult position for us to be in. So I am, I'm not sure what the formal recommendation is, but it sounds like we might hold on this and wait till we hear from MCPS. If that is the ultimate decision, I think that seems reasonable to me. But I just want to clarify that if that's okay.
Yes, we're going to put a pin in that because Councilmember Evans has a comment, and then we'll go back to this before we move along. Thank you.
Sure. So when I first saw Carroll Avenue and Quebec Terrace, I had an immediate pause too. But having served formerly on the YMCA's Youth and Family Services board, and I see someone in the audience, that makes me feel really comfortable because we were on there together. She's nodding her head in agreement of these reductions and that the support will be carried over. What I don't ever want to do is diminish the roles of the people sitting at the dais and not being respectful of the work that you do, because as Councilmember Friedson said, it sounds like you're doing exactly the things that have been asked of you in the past. And while I work with some of you, I have not worked with all of you, but I did find relief, and we can't do our work by nods in the audience, but because I know personally of someone who's worked closely with these families for, like, I'm gonna say a decade. I do respect what I'm seeing coming from someone who has served with me on that board, helping these families directly, knowing what their needs are, working very closely with the school system, trying to make certain that there is some advocacy work and sharing the work that's done on the outside in the community to continue to support our families and students in the school system. So if we do go forward with the reduction, I'm okay with it. And I've found a variety of ways to make myself okay with it. But I just did want to say that people up here are doing their jobs, but as we're doing our jobs, I am an empath, so I can't help but look at the expressions and sometimes the deflated faces that I see, and how our remarks come across to the people standing and sitting before us. So I just thought I wanted to say that, I'm getting better at not calling names from the dais because I don't know if people want to be acknowledged or called out. So I'm not going to say the name that I want to say, but I'm saying I find a great deal of comfort in seeing who I see in the audience, and being very reassured that we have someone by the name of Miss Martin. I'm going to call your name out because you're there, but talking about your former work as a social work. So I'm going to go off of that, and I'm okay with what we do with 'cause we move fast. 2.8 and was Quebec only, and 2.9. I mean, no, that was table 9, so just 2.8. Yep. Okay.
Yes.
And I'm done.
Oh. Yeah, go ahead.
Yeah, and just to be
Councilmember
clear,
Chair Jawando.
Yeah, that's all right. Just to be clear, as I said, it looks good on paper if the kids are transferred right, and I just want to make sure that they are. And just want to make sure we discuss this intentionally with everyone in the room when we get to full council on this item. So I'm okay with tentatively doing it pending further information, that kind of thing, so.
Yes, so that's the will of the, did you want to say something, Dr.
I was just
Martin?
going to reinforce what Chief Gary Aquino said, that her team had reached out to the community school liaisons at New Hampshire State's and Oakview Elementary Schools, right? Because it's both. It's the paired site schools. And, in these budget discussions, they had confirmed they had capacity to take on this number of children. But I understand completely, if I were in your shoes, the need to have MCPS here and affirm that as well.
All right, so we will hold off on 2.9 and 2.8 and wait until full council to confirm that we have all stakeholders in agreement for the smooth transition of the program. All right, All right, now we are on to 2.9. Thank you.
All right. So the last item before transitioning to my colleague, Ms. Clemens Johnson, and then discussing the memorandum from Councilmember Katz is a reduction of $349,121 to reduce two school-based health center somatic services to 3 days per week. So as the committee is well aware, DHHS currently operates a school-based health and wellness center at 6 high schools and 10 elementary schools to provide access to primary health care services to adolescents and children 5 days a week, and that's the school-based health centers for elementary schools. So they receive the access to primary health care services for adolescents and children 5 days a week. The executive's recommendation would reduce levels of service to 3 days a week for 2 elementary school sites. DHHS states that fiscal year 25 and fiscal year 26 site utilization rates are consistent, with Summit Hall Elementary School and Rolling Terrace Elementary School having high utilization of 4 to 5 days per week. Broad Acres Elementary, Gaithersburg Elementary School, Harmony Hills Elementary School, New Hampshire Estates, Highland Elementary School, and Weller Road Elementary Schools have moderate utilization at 3 days per week, while Southlake Elementary School and Veers Mill Elementary School have lower utilization at 1 to 2 days per week. And you can see the enrollment by elementary site broken out by race and ethnicity on circle pages 25 to 29. Per the recommended reduction, the department would revise the site schedule for Southlake and Veers Mill Elementary Schools to 3 days per week in their school-based health center. The Southlake Health Center would be closed on Wednesdays and Fridays, while the Veers Mill Health Center would be closed on Tuesdays and Fridays. DHHS states this would preserve access to high demand days, but would eliminate about 172 days of clinic access. Southlake Elementary School currently has 227 students enrolled in their school-based health center services and has had 96 unduplicated client visits, while Veers Mill Elementary School has 305 students currently enrolled with 126 unduplicated visits. I will note that all the other health center sites in the elementary schools do have a greater number of students enrolled and unduplicated visits. The department states the goal is not to reduce clinical services, but ensure workforce stability and avoid recruitment and retention risks. DHHS believes the revised schedule aligns staffing and service delivery with demonstrated utilization, reduces underutilized clinic time at low volume sites, maintains equitable geographic access across all 10 elementary schools, and preserves full staffing. And the students at those sites would still have the full-time health room services, the ability for cross-site scheduling, and DHHS will continue to have cross-site scheduling of staff within the health and wellness network, after-hour triage support services, and ongoing care and coordination and follow-up for those students. And the staff who would be impacted by the reduced days would be reassigned to other school-based health and or wellness centers with higher utilization vacancies and in support of care coordination and follow-up activities. And there would be no reductions in the currently filled positions or any salary reductions for those who serve in our school-based health centers. And council staff concurs with the executive.
Okay. Can you just elaborate briefly on the scope of services that students are seeking help for, and if they are seeking help on a day that there is not a nurse or social worker, health provider present, what happens?
So before my public health colleagues step in, this is on the somatic health end.
Yes.
So when you mention social worker, the behavioral health level of service would be the same. That would not be reduced with this reduction.
Okay. Yeah, what does somatic encompass?
So before I turn it over to my colleague, our senior administrator for school health services, I will mention that it covers a range.
Did you introduce yourself, sir?
My apologies. Sean O'Donnell, Deputy Chief for Public Health Services. So our school-based health and wellness centers see students beyond the typical urgent care that might happen in the school health rooms. They may see them for physicals. They may see them for immunizations. They may see them for other things that come up that require nursing or nurse practitioner or medical assistant support. So there's a range of these visits. Not all of them are urgent in nature, and many of them could be seen on one of the days when we're open.
Okay.
Like that.
Becca Urgesa. I'm the Senior Administrator for School Health Services. Yes, the plan we have is if a student comes into the clinic on the days that the clinic is closed, if it's normal routine, we try to make the appointment on the days that the clinic will be open. But if the student show up like for urgent care need in the clinic when the clinic is closed, we have the option also to make the phone call to the parent. They can come and pick them up and take them to the nearest clinics, and they don't have to sign up again. Once they're enrolled in that specific school, they can go anywhere in those 10 locations. So they can still get the urgent care service the same day, depending on the situation of the urgent care.
Okay. Thank you for sharing that. I'm okay with monitoring what this decrease looks like, and just want to be made aware in the event that we do have instances where students come in and they are unable to be seen immediately, given what the somatic services respond to. So if we can track that information over the course of the year, that would be helpful to see if this is an ongoing decision that makes sense. But I think without objection. Okay. All right. Thank you.
And now we will turn to my colleague, Ms. Clemens Johnson, to discuss the Lighthouse request.
Yes. Welcome back, Ms. Clemens Johnson.
Thank you.
We're on item 2.10.
Yes, we are discussing item 2.10 and 2.11, which is the Lighthouse Initiative. It is separated into two funding streams, and so we will talk about both of those. The Lighthouse Initiative supports socioeconomically disadvantaged individuals and families, particularly those navigating immigration-related challenges through our integrated community-based service network. There are two funding requests for the Lighthouse this year, and for this year, for the first time, it will be part of the base budget, so no more one-time funding, which is good for the sustainability of the program and just fiscal alignment in terms of managing the budget and future operations for the program. I do want to highlight that Lighthouse Initiative was part of the reorganization of DHHS, so it moved from the Office of Community Affairs that was under administration and support to children, youth, and families. So as we start with item 2.10, this is Restore, continuation of Lighthouse as a 3-year grant program and administrative support, an amount of $4.5 million and 4 FTEs. I will note none of the FTEs that we're talking about are new. They are currently funded, and these positions have been on board with Lighthouse, just with the manner of it being one-time funding that they always have to be reproposed each year. So in FY26, the Lighthouse program transitioned to a grant program that was managed by the Office of Grants Management, facilitating the NOFO process. And actually, with this becoming part of the base year funding, this will actually move the grant program to being multi-year, because that was a question council staff asked, is for this being such a big program, if it's going to be recompeted every year, it would be challenging to get on board. So it was shared by the department that this is intended to be multi-year moving forward. I will just go through, as we move through the staff report on page 24, the program provided some metrics. I think one important metric that we look at, if we look at the top of page 25, about the size of the families that are being served. There are families with 3 members and like two plus members are 324 families, 261 families, 237 families. So I think when we think about the services that are provided for Lighthouse, it's not just really about serving the children, but it's about serving that family as a whole. And so this program is doing the yeoman's work of supporting some of these new families in Montgomery County. I want to highlight that the plans on page 25 for the FY27 Lighthouse Grant is expanding their outreach efforts to increase engagement across diverse communities, enhancing coordination and referral systems amongst partner organizations, strengthening their data collection and reporting to improve program monitoring outcomes, increasing access to legal workforce and stabilization service based on identified needs, and really incorporating feedback from those listening sessions with those families that participate in the program to ensure services remain responsive and effective. As noted, there are 4 FTEs for the program, and the Lighthouse Grants Fund requested are about $1 million more than the FY26 grant. DHHS provided additional details about how those funds will be used within the packet. So with item 2.10, council staff concurs with the executive's recommendation.
Without objection.
All right, we will move on to item 2.11. These are the wraparound services provided for the Lighthouse. So the funding that we just talked about was for the grant specifically, but there are also staff at DHHS that support the Lighthouse program. They are detailed on page 26 and page 27 of your packet. There are 7 FTEs that are currently filled that support the wraparound services. They're case management services, mental health services. They also operate contracts out of this funding as well to help provide those wraparound services that support the grantees. And council staff concurs with the executive's recommendation.
Okay, so that's 12 full-time employees across both programs, so 8 for the 2.5 program. Okay.
Correct, and the number of FTEs hasn't changed. It's been maintained over the 5 years that this program has been in existence. So there has 11. Wow.
Yeah, that was why I was like one.
Oh, yeah, there was a removal of one. Yes, there.
Oh,
yes,
okay.
There was 12 FTEs in
okay.
FY26, and now there's 11.
Okay, perfect. All right, without objection. And that is, and then
I believe that concludes all of the CE recommended
Yes.
items, and there was an item provided by Councilmember Katz. My colleague will go over.
all right. Thank you, Ms. Clemens Johnson. So back to you, Ms. Nicole Rodriguez Hernandez.
Sure. So earlier today, Councilmember Katz transmitted a memorandum to the members of the Joint Committee requesting support for $200,000 to be added to the reconciliation list for linkages to learning services at Twin Brook Elementary School, as the memorandum states, and we will upload this memo to the website as an addendum to the staff report as well. It would support a full-time family care manager and full-time child therapist, enabling about 20 students per month to receive much-needed behavioral health supports and about 32 families for case management services. These are based on prior conversations and models from the Linkages to Learning program, and this would be based in existing classrooms that would be retrofitted for the services of Linkages to Learning and would not require a total renovation enhancement. However, we would also like to note that there were placeholder funds available in the executive's recommended fiscal year 27 to 32 CIP for Linkages to Learning and school-based health sites as well. So there is additional funding there available. However, while Twin Brook was on the list for a Linkages to Learning site in fiscal year, or to start design for that Linkages to Learning site in fiscal year 26, it was removed from the fiscal year 27 to 32 CIP due to the fact that DHHS and MCPS have been tying facility projects like Linkages to Learning based on construction plans from the MCPS side. So MCPS removed their planned funds for Twin Brook Elementary School's renovation sites, which is why the Linkages to Learning site is not moving forward in the recommended CIP. However, as Mr. Connolly from MCPS stated in that CIP work session, there is the ability to utilize existing space for Linkages to Learning sites at the school. So this is the council member's memorandum to add that funding for Linkages to Learning services, and would also turn to DHHS to provide any additional context on what that may need. Thank you.
Go ahead, Councilmember.
I was going to say, I'd like to move Councilmember Katz's request that we add this to the reconciliation list. I know it can be done operationally, as you noted, without an impact to the separate CIP budget, and so I think it should be left for consideration for full council on the reconciliation list.
All right, moved in second. All those in favor? All right. That brings us to the end of our agenda. Thank you, everyone, for the discussion, the important decisions, the outstanding decisions. Thank you to our two analysts, MCPS, the HHS staff and leadership, our analysts. Thank you so much for being here and creating these packets and all the research that went into this packet. So without any further business, we are adjourned. Thank you.